Hi, everyone. My name is Lucas Richert. I'm the George Erdung Chair of Pharmacy, and I'm also the Historical Director of the American Institute of Pharmacy. I'm not Emily Dufton. Emily Dufton, who was scheduled to introduce today, wasn't able to make it, and so I'm filling in. It's my pleasure to introduce Markus Wahl. Before I say more about Dr. Wahl, I wanted to just say just a quick word. It's World Pharmacist Day, and it's a pleasure to welcome you all here on World Pharmacist Day. And I just wanted to extend a warm welcome on behalf of the UW School of Pharmacy and the American Institute of the History of Pharmacy. If you don't know about the American Institute of the History of Pharmacy, let me just tell you a little bit. It's dedicated to the collection and preservation of historical materials, including artifacts and images. The Institute sponsors a wide range of awards for students and established researchers. These include annual prizes for scholarship, and so you can learn more at the website, aihp.org. So you can learn more about the Crummers Award, the Sonnedecker Prize, the PhD Thesis Support Grants Awards. AIHP is also dedicated to high quality publishing. Since 1959, AIHP has a journal called Pharmacy and History, and I'm happy to announce in 2021 that it is going to be modifying its name. It'll no longer be Pharmacy and History. It'll be History of Pharmacy and Pharmaceuticals. Breadth and scope of the journal. Doing so, the journal is now going to be associated with UW Press. So I'm absolutely thrilled to think about what the future of the journal holds. Which leads me to our speaker, Dr. Markus Wahl. Among other accomplishments, happens to be the book review editor now for Pharmacy and Start 2020. He's going to be associated with the history of pharmacy and pharmaceuticals, and that's going to be great. Dr. Wahl is a research fellow at the Institute of History of Medicine, Robert Bosch Foundation in Stuttgart, Germany. And in his current project, he investigates the experiences of patients with diabetes and alcohol addiction in the socialist healthcare system of East Germany. In 2017, he received his PhD from the University of Kent for the dissertation, Treatments of the Past, Medical Memories and Experiences in East Germany, which was subsequently published as a monograph by Routledge in 2019. Other recent publications include The Workhouse, Dresden-Lubin after 1945, a microstudy of local continuities in post-war East Germany in the Journal of Contemporary History. In general, his research interests gravitate towards modern German history, social history of medicine, socialist history, memory and addiction studies, as well as the broader studies of sexual health in the past around the world. It's my pleasure to introduce Dr. Markus Wahl. Thanks so much for being here.
Well, thank you very much, Lucas, and thank you all the organizers for this opportunity to present my work here, and thanks all to you I'm really honored to speak in front of so many international interdisciplinary colleagues, and I hope I can fulfill those anticipations which have been passed on before. So with further ado, I will just start. And in my paper today, I want to focus on drug abuse and addiction in the former German Democratic Republic, so GDR. Because like alcoholism, this phenomenon could not or should not exist in a socialist society, at least according to the state narrative. However, as my paper will show, this was wishful thinking Or better, it was a claim based on the traditions of socialist movements from the beginning of the 20th century with contemporary relevance to the Cold War struggle. It was basically part of legitimizing why socialism was superior to the capitalist system. And to explore the situation of this rather silenced social issue in the GDR, I will zoom into the 1980s, giving you first a brief introduction into the general situation in the healthcare system, after which I will discuss the interesting fact why hard illegal drugs were hardly used in East Germany, and before going into more details of pharmaceutical abuse and addiction. All right, in the last decade, of the socialist state in Germany, the healthcare system suffered under the ever-increasing financial problems and shortages of the GDR's planned economy. Sometimes hospital wings had to be closed due to structural defects of the buildings, such as leaking roofs or pipes, etc. Surgeries had to be postponed because of the insufficient medical personnel or the lack of necessary material. Treatments had to be improvised or delayed due to the scarcity of pharmaceuticals. In light of these issues, the GDR health minister, Ludwig Mecklinger, remarked during a meeting with the State Security Service in 1984 that he has serious concerns regarding the further development of the healthcare system, quote end. The Stasi, like the operation of the State Security Service, the Stasi registered in its long reports about the mood and statements among the medical staff and population a rise in negative attitudes towards the state and its achievements, and especially towards the conditions in the medical institutions. Even without a retrospect judgment, as the end of the socialist state was not foreseeable at the beginning of the 1980s, the described situation represented a severe threat to GDR's legitimacy. The healthcare system was always crucial in the ideological struggles between socialist and capitalist countries, demarcating the state medical provision from the private system and, as I mentioned before, claiming superiority. And I quote Mecklinger again, "In the encounter with the health and social care system, socialism has a name, an face and an address for the citizen," quote end. And he said this at a conference in 1981. However, the divide between political claims on one side and the reality faced by doctors, nurses, and patients in their everyday lives revealed the perceived ignorance and also lack of contact with local conditions of the socialist vanguard. So the resulting frustration would support the growing oppositional movements during the 1980s in East Germany. To compensate for the widespread domestic unrest, it appears that state authorities aimed for international successes and recognition. And one crucial aspect was the fight against the international illicit drug trade, especially the GDR as a frontrunner in these efforts, and thereby distancing itself again from West Germany and at international commissions. And in the reports and papers and presentations to the delegates, GDR officials always emphasized, like at the International Seminar for the Fight Against Drugs in Alexandria, United States in 1989, that hard drugs like cocaine, hashish, and heroin played no role in East Germany. And in line with the argument that alcohol dependency was also foreign to socialism, they stated that the conditions of the socialist society like, and I quote, the right to work, to receive education and vacation, the life in social security and comfort, quote, and would prevent drug addiction. Not only in official documents or ideological statements like that, but also in the internal analysis of the Stasi, the number of recorded cases of drug users, also like illegal drug users, in the GDR was constant around 100. Well, of course, the unrecorded cases were probably 3 or 10 times even higher. However, even considering that there are probably lots of unregistered cases, East Germany seemed to be mostly a transit state for the illegal drug trade to West Berlin, West Germany, or also the Scandinavian countries. The reports, however, lack an explanation of why hard drugs were uncommon in East Germany, why other states like West Germany, or even Poland, Czechoslovakia, and the Soviet Union registered a continuous rise of abuse and addiction. Strict border controls and drug prevention laws, mentality, and social or economic conditions were not unique to East Germany to explain these striking differences. I can't answer this for you now, but I think it's an interesting topic for future studies and investigations. However, GDR officials use the fact that almost no cases of cocaine or hashish abuse existed in this for their state ideological campaigns, proclaiming their spearheading efforts in fighting drug trade and addiction at international congresses. However, despite these claims and in contrast to these hard illegal drugs, the GDR faced an increasing number of people with alcohol addiction and pharmaceutical abuse, especially during the 1970s and 1980s. The general ideological narrative was that East Germans would no longer need alcohol to be happy, quote end. However, the Health Ministry report admitted already in 1970 a rise of cases in alcohol addiction and pharmaceutical abuses of sedatives, analgesics, and tranquilizers in the last years. The consumptions of sleeping pills, for example, in the GDR rose from 4 to 6 or 7 per capita within 4 years. And as state authorities expected that this trend would continue in the future, they established a Central Bureau for Addictive Substances at the Ministry of Health in 1973, which was responsible for recording cases and analyzing the development in the GDR. But how reliable the reports are is questionable, because there were never a central directive how to register these cases and how to also prevent these and how to go on when you find them. The creation of the Bureau has to be seen in the context of the transit agreement with West Germany, meaning they established 3 routes through the territory of the GDR of East Germany from West Germany to West Berlin, which was basically an island in the territory of the GDR. And state authorities were aware that opening the borders, like the 3 autobahns, certain transit routes to West Berlin, could also cause a growth of narcotic trade to East Germany, while also domestic problems with alcohol and pharmaceutical addiction also aggravated. Therefore, the situation in the GDR kind of followed international developments. Tranquilizers and sleeping pills experienced a boom among the people as little helpers from the 1950s onwards, maybe a bit delayed in the GDR. And the medical field, of course, realized soon or had to realize soon that the addictive and subsequently harmful effects on the body and psyche. In East Germany, the morbidity rate of pharmaceutical abuse or addiction per 100,000 citizens rose from 15.3 in 1979 to 19.7 in 1982. And the most commonly used drugs in the GDR in 1984 were sedatives based on benzodiazepines, meprobamate, barbiturate-free synthetic sedatives, as well as barbiturates. Furthermore, painkillers and appetite suppressants were also on this list. However, as with the hard drugs and alcohol addictions, GDR authorities belittled the abuse of pharmaceuticals as remnants of the past, a problem that could not last under socialist conditions. Only in capitalist states, as part of people's reactions against the exploitation in these systems. Therefore, the authors of the report from 1970 were eager to point out that, and I quote, the causes lay in a certain surmountable imbalance between the social and natural environmental conditions and the adaptability of the organism, which lead to psychological conflicts, situations, or failures of the regulations mechanics of the body. I'm sorry, this is a very cumbersome sentence and translation, and I apologize for this. What it basically means is there are objective, perfect conditions around you, and you as a human being basically reject it. You know, you basically are opposed to socialism, and this is why you get sick, and this is why you are addicted. This was basically here the narrative. And these arguments correspond to the general social engineering project of the socialist state, creating socialist personalities. And in this idea inherent was the claim and right of the state to educate its people who would not yet be ready for socialism or communism even. And this is a feature of the GDR as a welfare dictatorship combined with social didacticism and a paternalistic approach. Moreover, state reports thus failed to explain why especially women abused pharmaceuticals, whereas men would almost solely fall for alcohol, sometimes in combination with drugs. I can't go deeper into this now, but I wanted to mention at least the gender perspective here. Despite its recognition in the medical realm, the absence of this topic in internal documents of the GDR authorities exemplifies the ignorance of social problems which could not exist in the socialist society. Taking a step back, ideologically, deviance, also in the form of sickness or addiction, was thus interpreted as a possible sign of a person's opposition to the lawful development of socialism. And they go so far to say that the right political consciousness, social work, and a firm standpoint politically would, according to this understanding, lead automatically to a healthy lifestyle. If it would be so easy, right? Anyway, therefore, the 1970 report reasoned the increasing number of people abusing pharmaceuticals in two ways. First, instead of health-promoting exercises and changes in working life, people would prefer medicines to overcome their psychological conflicts. Therefore, doctors' prescriptions would prevent the adaptability of the body and mind to the new social conditions. You see, basically here the doctor becomes the enemy of the state because he prevents the people from, get adapted to socialism, to the new society, which would be perfect for them to emancipate to their best performances, whatever. Second, patients, on the other hand, expect that they receive medicine, which quickly cures their medical problems if they consult a doctor, feeling neglected when the physician would refer to a change of lifestyle. That's the other hand. And these aspects combined led to increasing consumer culture, consumer behavior of patients and doctors similar to the West, which the GDR actually tried or aimed to avoid and to overcome. Why the rationale behind these arguments in the 1970 report resonates even today, as you know, people prefer sometimes a pill over changing their habits. In East Germany, state authorities used it to deny the existence of social problems. If deviance occurs, the fault was individualized and the affected marginalized. The argumentation that addiction was foreign to socialism inhibited not only that state authorities could address the issue in public without undermining state narrative and legitimacy, but also inhibited a central strategy for preventing the abuse and treating people with, for example, a pharmaceutical addiction. And this ideological adherence and the simultaneously increasing numbers of alcohol and pharmaceutical addiction cases created a vacuum which was filled by local initiatives of doctors, psychologists, and patients to improve the integration at work, the treatment, and the general social situation of the affected at the local level. And this situation, I think, complicates the analysis of the experiences of people with addiction in the GDR, as their experiences always depended on the local conditions, authorities in charge, and mentality of the medical personnel and social environment. To conclude, it would be too easy to say that the GDR was a failed state in at least two ways. The shortcomings in the healthcare system, which I pointed out at the beginning, and the failure to address and act upon the social problem of addictions. However, in both cases, people on site at the local level used their leeway, improvisation skills, and informal networks to improve the situation, even if in the limited realm of socialist principles, because they had always to report to the higher echelons of the state, of course. The increasing gap between the claims on the one side, as claims and propaganda of the state on the one side, and the everyday reality of the people on the other, was, however, one important aspect in the oppositional initiatives and movements during the 1980s that led eventually to the end of the GDR. Thank you very much for your attention. And I'm looking forward now to your questions.
Wow, thank you kindly for that fascinating talk, Markus. Just to remind the audience that it's late in Germany, and so he deserves double amount of plaudits for this. And then also, I mean, you stuck to time too. So, I mean, we got to thank you for that. I'm gonna, as people collect their thoughts and throw in questions in the chat box, I'm gonna pinch the first question if you don't mind. And I guess the thing that immediately occurred to me has to do with patient records and whether or not you have access to any records of citizens who are struggling with pharmaceutical addiction.
Yeah, thank you. Unfortunately, only one. From the vast majority of patient files I have so far are with alcohol addiction, I have to say. The issue is, as you know, COVID-19, I'm due to visit a hospital, a psychiatric hospital, which has to do a sample from the course of the GDR to see how also treatment plans changed, and if there's any like rise of cases in pharmaceutical addiction and alcohol addiction, or is there any correlation to each other? Yeah, I unfortunately have to postpone the answer to, or basically I can only say I hope I will find much more about this. However, I have documentations of therapeutic clubs, which I might talk about a bit more later, where basically people with addictions meet, and there are documentations about it, and there are statements about how they struggle with their addictions, if it's now alcohol or pharmaceutical addictions. These I would call it primary source, is definitely available to me already.
Yeah, okay. Thanks for that answer. There's one question here from Nancy Campbell. She says, thank you for your excellent analysis. Could you tell us some detail about what the local level committees implemented?
Yes, thank you very much for this question. So it always depended on where you are, and of course on the commitment of people in charge. This is what I tried to mention at the end. I know I haven't gone into details there. Let me try to do it now a bit. The initiative started from basically the grassroots level, and it started with doctors or patients recognizing the issues that there are no self-aid groups or anything, because GDR authorities wouldn't allow this, claiming in a state medical system you don't need the self-aid groups like the anonymous alcoholics, which were present in West Germany, because you are cared for from the state, all encompassing. But however, why the state retreated, here local people jumped in, basically again patients, psychologists, and doctors, and started around in the 1970s. You can see popping up these patient clubs, as they are really called clubs. But in difference to the anonymous alcoholics, they were led always by medical personnel. They were never like alone as a self-sustained. Maybe not the right word. I'm sorry.
Yeah, no, I think that is. Thank you for the answer. A question from Arthur Damerick: how we understand and analyze shifts between the individual and community or society. And in a socialist system, did the analysis of the cases evolve over time, or did it stay consistent? You hinted this in your talk, but I'm curious to hear any change over time.
Yes, that is very. Thank you for this great question. Yes, the focus of my talk was 1970s, 1980s, or especially 1980s, because this is the time when this issue really becomes prevalent. Like state authorities have somehow to react, and however somehow get lost in lots of discussions with no real central strategies. And again, the local level jumps in. Before that, they always believed that things would just, resolve itself. Basically, prostitution, alcoholism, addiction in general, that would just become a thing of the past. You can see this in the 1950s very well, where hardliners and idealists in the party basically fighting against each other about the curse and of the party and of the policies, and basically trying also to establish pubs where no alcohol is served and stuff like this, but facing then a bit of a public unrest.
Yes, yeah. Right.
Yeah, so anyway, you can definitely see a change over time. And again, it's a beginning in the 50s and 70s. It's being really denied and not even registered, apart from if it becomes a criminal case. After the 70s and 80s, basically because of the medical realm, more and more picks it up. The state also puts it into consideration but fails to act upon it.
Mm. From Dr. Greg Bond here at the Institute, in modern Germany, are there lingering manifestations of the different drug control and pharmaceutical regimes that existed in East Germany and West Germany?
That is a difficult question, and I would, from what I know, I wouldn't say that there are, no, there's no different, actually no different drug control. I don't think there's, especially regarding when you look at crystal meth or something like this, it's kind of all over the place, even if it's especially prevalent at the border to Czechoslovakia. So there are, it's a very difficult question to answer, I have to say. But I can't really see that there are still lingering manifestations in this.
Mm-hmm. Considering there are no other outstanding questions in the chat box, what I wanted to do is, again, sincerely thank you for speaking to us so late in the day for you. I also want to point everyone on this call and listening in towards tomorrow's sessions. What we've got is another full day of excellent talks, just like this excellent talk. And so I encourage you all to show up and maybe tell other people as well. So I hope you all have a good evening, if it's early evening or late evening. And again, thank you so much, Markus.
Thank you. And thank you for the great questions and the opportunity to talk here. And I hope I will have all a great evening and see you around.